So jumping in, for those of you who might not know us, this might be your first touch point with us. I just wanted to give a very quick overview of 211 Virginia. So 211 Virginia is your easy to remember 3-digit dialing code that connects people with information on services. The way we do that is that we keep a directory of about 16 to 18,000 programs. So there's quite a variety in there. And when people call us or contact us, we do some pre-screening, we ask some questions, and then we match them up with resources that they are eligible for and that are in their area. So we do this all day, every day. We are available 24 hours a day, 365 days a year. We are truly always open. We are free and we are confidential, and we are nationally accredited through Inform USA, which just means that we follow some standards for quality assurance in terms of how we curate our data and how we provide those referrals. And a little bit about us specifically is in Virginia, we are a contracted service of the Commonwealth. So 211s are available in most of the United States and Canada to some degree. In Virginia, we are contracted through the state. So the contractor is my employer, that's the Council of Community Services, and we are funded and administrated by the Virginia Department of Social Services. So we are kind of a public-private partnership is how we kind of phrase it. We have both some nonprofit touch and some state funding and administration. And we've actually been around since the 1980s in the Code of Virginia, although the 211 number itself didn't launch until February 2006. And we do celebrate that anniversary every year on February 11th, 211 Day. And this lately we've been celebrating with 211 Week, so making it a really big deal. Like I said, we do have that directory of over 16,000 programs. That number is going to fluctuate day to day, and then we are nationally accredited. So I mentioned that Code of Virginia that we are built in. So I'm not going to read this word for word to you, but just to give you an idea, this is what is required, and these are kind of how we inform our mission and our service provision. So the 2 points that I want to really highlight today are highlighted in red, and that's going to be collecting and maintaining accurate and complete resource data and assisting in planning for human services delivery. So we do all of these things, and there's many activities that go into accomplishing kind of each tenet of the Code of Virginia, but something that we're focusing on today is going to be that data piece. So when we talk about the different types of data we collect, we're going to talk about resource data and need data. So resource data, and you might remember that was on the first tenet of the Code of Virginia. When we talk about resource data, we're referring to information on organizations and their services. So when you list with us in our directory, that information is saved and allows us to kind of create a picture of service provision in Virginia. Like I said, we have about 16,000 to 18,000 programs. So we're able to see a pretty good picture of what services are available where, what services are available to whom. We can kind of get really deep into it if we want to. We ask y'all for a lot of information so we can provide accurate referrals. So we have a pretty good picture when we're able to sit down and capture it. And then the second half of what we collect is our need data. So when we're talking about need data, we're talking about our individuals, how they contact us, and the information we give to them. So we do collect some information on individuals. We have contact records for the people that contact us, and we'll ask them for kind of some basic demographic questions. They don't have to answer anything they don't want to, but when they do give us some answers, then that helps us segment and report on maybe what kind of resources are being used by which populations. We can ask about age, we can ask about disability status, veteran status, all those different things that could play into eligibility for a program or service. And then we'll also collect contact and request information. So when someone contacts us, we'll figure out how they contacted us, what contact method they used, what time of day, how long they waited in the queue. We're kind of collecting pieces of information about every step of that person's contact with 211 Virginia. And then finally, of course, we're going to record information about what they're requesting and how we were able to help. So we'll record kind of what we've searched for them, and then we'll also record the information that we give to them or the information that we're not able to provide. And I'll get into these definitions in a minute, so I'm going to leave that a little vague for now. So I have these slides as call outs. So I mentioned there's resource data and need data. These are the definitions you're going to see throughout the day today and within our reports if you choose to go access those and look through them yourselves, which I do hope you do. There's a lot of good information in there. So these are the specific definitions related to resource data that you're going to see. And that is your agencies. When we talk about an agency, we're talking about an organization. When we talk about a program listing, that's the specific services of the organization. And that's what we're actually going to be sending our referrals to. And then the other term you're going to see is program types. And this is just kind of how we classify things. You'll see us use this term interchangeably with keywords because it's how our team searches the directory to find programs for people. And this is just a visualization of that listing structure that I'm talking about with our agencies and our program listings. So in fiscal year 23 to 24, which is what we're talking about today, this is kind of what our record looked like. We had agency information up here at the top. That's your main account. That's how you log in. You can see all your program listings. And then underneath the agency information, we have your programs. And each of those can have their own contacts. They can have all their own information. But they're all kind of tied to this one organization. And then as of fiscal year 23 to 24, we did also have this administrative entity listing. That was just your agency information copied over into a program listing format so that we could refer to it if we needed to. We're likely going to be moving away from this structure with our new database and website and all the shiny new things we have coming. But this is the structure we were looking at for the time period we're discussing today. And then just a little bit more on classification in that resource data. So we do classify all of our program listings and services according to Inform USA. They have a giant taxonomy that they have developed that's kind of similar to the Dewey Decimal System. It's like once you know it, you kind of get it, but it takes a lot of studying and time to really get to know that taxonomy. We do classify programs according to geography. So we have 6 region codes that are unique to 211 Virginia. And then we can also classify programs by their zip code, their county, their city, their planning district, VDH region, VDEM region, VDSS region. We have a whole list of different ways we can classify that geography, their service areas and location. And then in terms of service provided, that's where we get into the taxonomy. So we use about 730, 725 taxonomy terms, and those all have unique codes. So this kind of scary looking number down here, that is the Inform USA taxonomy term or code. Those are hard to remember and memorize and not super intuitive to search. So at 211, we have kind of made a system in Virginia based on our knowledge of service provision and come up with 440 keywords or program types. And those keywords or program types are all assigned to taxonomy terms. Sometimes there's multiple terms assigned to one keyword or program type. We have about 440 of those. So those are what our team uses to search the directory when we're looking for referrals. You can see here, this taxonomy term, TJ 3000, 8500, maps to the keyword 211 systems. I figured I'd use ours to get us started. And then we even go one step kind of broader. So that 440 is still a lot to remember and certainly more than we would expect anybody outside of our organization to have memorized or to have working knowledge of. So we further separate that into 17 searchable 211 Virginia needs categories. And this is what you're going to see on the homepage of our website when you come in. This is how we kind of start your searching process. So in this case, 211 systems would fall under the need category of information services. So that's our resource data. And then I'm going to spend most of our session this morning talking about need data. So again, these are the definitions that you're going to see in all of our reports that we go through today and also in reports when you go and check them out on your own. So we're looking at individuals and inquirers. And when we say that, that is going to be the estimated number of unique people who contacted 211 Virginia. So they can contact us multiple times. We do have a good amount of repeat callers, and that number will be captured by contacts. So contacts is the total number of calls, texts, chats, emails, any kind of interaction that we have with a client or individual. And that's going to be, again, within fiscal year 23 to 24. From there, we get into referrals. So when we talk about referrals given, that is the actual number of resource referrals that we provided to people that they accepted and left the phone call or the contact with. We try to give multiple referrals per need request. So if somebody contacts us and says, I need help with both rent and my utility bill, then we'll try to give them a couple of referrals for rent and a couple of referrals for their utilities. So we try to give a couple different options. We do, however, have instances of referrals not given, which essentially just means that that's the number of times where we were not able to complete a referral to a matching program. And I'm going to talk a little bit more about that. This has its own slide, so I'm moving past it a little bit quickly right now, but we are going to spend a little time on that. And then your referral success rate, so we're going to be mentioning that a couple times throughout the day. The math on that is we just took the number of referrals given, we divided that by the total of referrals given and referrals not given. So it's not a completely perfect number, but it does give us some idea of our success and how often we're able to provide a referral. So to kind of help understand, I know we're throwing a lot of information at y'all. We're going to kind of slow down and walk through that process step by step. So this is the anatomy of a call. This is a very simplified version, but this is kind of how it starts. Most people that contact us are in need and uncertain of solutions. Their brain kind of looks like it does on this slide here, with just all of these questions, no real idea of how to get started. We all know that Health and Human Services can be a maze, and navigating where to find help, where to apply, where to even get started can be a challenge, even for those of us who work in this field every day. So what we're going to do is we're going to try to straighten out that confusion. And the way that happens is when someone calls us, first we're going to chat with them, we're going to establish a rapport, we're going to try to get them into kind of a level-headed state of mind where we can provide referrals and they'll stick. A lot of people that call us are in some kind of distress or confusion, and so we'll try to address that first. From there, we'll ask them about their situation. So we'll just kind of say, what's going on? What are you calling about today? What do you need help with? And as they share their situation, our community resource specialists are going to be listening for those keywords I mentioned. So someone might say, rent is just crazy right now, and I am so overwhelmed. And they'll listen and they'll be sympathetic. And on the side, they will jot down the keyword rental assistance. And they'll think, I might need to search that for them. When they've kind of finished sharing their situation, we're going to ask them if they're comfortable answering some demographic questions. Again, these are all completely optional, but we do ask everybody. And then they're going to paraphrase back to them kind of what their notes say on the side. So if they say, I heard you saying that rent's really overwhelming right now. Would it be okay if I search the directory for rental assistance programs for you? So we'll paraphrase back and ask for permission to search for those needs. Then we will, and we'll search for those appropriate and accurate referrals. Ideally, we'll find 2 to 3 per need that they've mentioned, and they will leave the call prepared to take the next steps. They'll have a list of referrals, all of them work out, and it is all sunshine, rainbows, and everything goes exactly as we hope it would. That happens a good amount of the time, which is great, but it doesn't always happen that way. Sometimes we're going to turn a contact into a follow-up. So our team follows up with a certain amount of callers every month, and they're going to just kind of check back in with them to make sure that they were helped or to see what happened. It's up to them who they mark for follow-up. So that can typically include those who are struggling with basic needs. So housing, food, utilities, transportation are all basic need categories. Maybe those who are suffering from some sort of natural disaster. So Hurricane Helene would be an example. Or people that belong to kind of our more vulnerable populations, whether that's our senior citizens, individuals with disabilities, maybe veterans, those kind of populations where we want to check back in and make sure they're receiving the resources or that they're able to access them. And then I'm coming back to that referrals not given. So other callers might also have instances of a referral not given. And here's what I mean by that. So when we search, it does not always result in an accepted referral. And when that happens, we will document a referral not given. what that looks like, that documentation is going to be the program type that we searched for, the location we were searching within, and then the reason that we were unable to provide that referral or complete that referral. And there can be lots of different reasons that that happens. They're listed here on the slide. The first is kind of the intuitive one, that there's just nothing in the directory, nothing that matches that need and location in our directory. However, that's not it. We do have a couple other reasons that a referral might not be given. Another can be that they just ended the call or refused referrals. They might have come in with multiple needs and kind of got a list of referrals for one and said, you know what, I just want to start there. I don't need referrals for this other need. And they end the call. That would be a referral not given, but it's kind of their choice. The other can be that the individual is ineligible for matching programs. So this was our most common reason in fiscal year 23 to 24. And this is that we were able to find programs in our directory, but they just weren't eligible to receive service from those programs. Another can be that they were too far away. So again, we found programs within their specified location, but for whatever reason, that resource was not accessible to them. And then it could also be that they already used the programs we have in our directory. So all of those reasons are going to count as a referral not given. And of course, we don't love to see a referral not given. That means that we weren't able to provide aid for that specific need request. But what we do take pride in is that thorough documentation piece. So with that information, we are really able to tell a greater story for the region and talk about what needs are going unserved and why. And the data that we collect on that can help increase funding. We are happy to share that data for grant applications and kind of those kinds of things when you're looking at resource allocation, supporting new programs, and then also informing new legislation. I know we have some elected officials or representatives from their offices joining us on the call today. If you are, thank you so much for being here. And this is kind of data that we would love to provide to y'all. We're excited to share throughout the day today. All right, the last thing I'm going to do in this section is do a very quick walkthrough of a call to 211 Virginia and how that data is collected as we move through. So I'm going to ask you to meet Maria. Maria is going to be a woman between the ages of 18 and 50 who is searching help with basic needs, and that does represent the majority of the individuals that contact 211. So throughout this little story that I'm going to share, you'll see the relevant definitions up here at the top of the screen. These are repeated from the slides before, so I'm not going to take the time to read them out again. You can reference them as we walk through. So this is Maria. Maria has called 211 Virginia 4 times in the last fiscal year. So that would be counted as 1 individual and 4 contacts. We're just going to focus on 1 call for the rest of the example. So this is going to be 1 individual, 1 contact. But on one of her calls, Maria is going to ask the community resource specialist if there are any programs that can help her to pay her bills. And the community resource specialist is going to listen. She's going to ask some clarifying questions, and then she's going to match up her needs with 2 specific program types. So she might say, okay, well, what specific bills do you need help with? And Maria might say, rent is super overwhelming right now. I'm having trouble with that. She'll document financial aid rental assistance. And then she might say, and utilities are crazy too. We'll say, well, is there a specific utility bill that's, really ramping up lately? And she'll specify that it's her water bill. So we'll write down those 2 program types. And then Maria's going to get asked some questions about herself. Our community resource specialist will ask those demographic questions, and then they'll start searching for program listings that fall under the program type rental assistance. So we'll start there. When they do their search for the specific location and need, they do actually find 6 program listings that fall under financial aid rental assistance and are within that geographic area. So they're going to go over those program listings with Maria, and Maria accepts referrals to 3 of the program listings. So that's going to be counted as 3 referrals given. So the next thing they're going to search is financial aid water. Remember, Maria didn't just need help with rent. She also said her water bill was high. So we're going to search for financial aid water. In the directory, we're only able to find 1 program listing serving that type in Maria's area. And unfortunately, Maria is not eligible for the program. So this would be counted as an instance of a referral not given. So we're going to send Maria on her way with her list of referrals to the financial aid rent programs. And then the community resource specialist is going to document what happened on the call. So they'll document that referral not given. They'll write down the program type and the reason we were unable to provide a referral. So in this case, it would be one referral not given for the program type of financial aid water in Maria's location or service area. And the reason would be that the individual was ineligible for that program. And then we'll also document the 3 referrals given. So we'll keep track of the name of the program. We have identifying numbers for each program, so we'll put that in as well. The type of program, so in this case, financial aid rent assistance, and the location that we referred to. And then this will be a summary of what it would look like if we did a report just on Maria for this year. We would have 1 individual, 1 contact. Again, we were just talking about this 1 call, 3 referrals given, 1 referral not given, and a 75% referral success rate. So this is kind of the summary. These are numbers you're going to see throughout the day today. And just remember that for every individual, there's a Maria. For every contact, there is a Maria. For every referrals given, there is a Maria. There's somebody behind every single one of these numbers that we're going to see today. And this is just kind of one example of how this could work. And well, Maria is a made-up character for this morning. Like I said, we did try to come up with numbers that were fairly representative of what a typical call would look like for us. Okay, and we have just a little bit of time if you have any questions about this data. We've got about 5 minutes before we transition into our first kind of regional presentation for today. So feel free to utilize the chat or the Q&A function. I'm going to stop share so that I can fully respond and see everybody's input. Awesome. Oh, and thank you for the positive energy in the chat. That's really kind. And I'm also going to stop recording.